Hi, I am Dr. Prashanth R Reddy. When a person is diagnosed with obstructive sleep apnea or snoring, we initially evaluate if the patient can be managed by non-surgical modes. These include lifestyle changes wherein the patient can reduce weight, can have different sleeping options, sleeping patterns can change, and also try to give them CPAP therapy. CPAP therapy involves giving a patient a mask which will be on the face all throughout the night, and if the patient is comfortable without any kind of desaturation affecting the sleep, then the patient can continue with CPAP machine and benefit from the CPAP machine. So many a times patients who are not compliant with the non-surgical treatment for obstructive sleep apnea, they would get advised surgery. Surgery is more of a long-term and permanent cure for snoring. Many of you will wonder what kind of surgery is done for snoring. Will there be any cuts on the face, any cut on the neck, cut on the throat, or any other issues? So, snoring surgeries are done for patients who have anatomical issues, especially inside the nose. So, we correct the nose. Usually, it is a multi-level surgery because the snoring is at multiple levels. It can be because of the nose, it can be because of the back of the nose, it can be because of the oral cavity, it can be because of the throat. So based on what level the obstruction is occurring, we address it. So initially when a patient for snoring comes, we evaluate the patient by doing an endoscopy of the nose and the throat, and also if required we go for a sleep test if they have not done it previously. On evaluation of the endoscopy, when we pass the endoscopy, we evaluate the whole thing and assess if there is any anatomical issues which is causing obstruction within the nose. We can address that endoscopically with a zero scar surgery of the nose, and in the throat we'll have to see if there is a collapse of the oral cavity or if the soft palate is extremely elongated. So we address that. We address the palate by pulling the palate forward and suturing the palate forward into the hard palate or towards the hard palate, thereby increasing the space behind the nose, and secondary to that the patient can reduce their snoring. Because of reduced snoring, their sleep will improve and also their stress levels will reduce, and that in turn will lead to them having a healthier life. Snoring surgery involves the patient will usually get admitted one day before the surgery. The anesthesia doctor will come and evaluate you thoroughly based on what and all risk factors are you associated with. If you have diabetes, hypertension, or any other comorbidities like hypothyroidism, they will take the history and they will evaluate, because the snoring surgery is quite complex a surgery. It's quite complex because the anesthetist and the surgeon share the same airway. So surgery has to be done very skillfully, and hence the anesthetist will have to be skillful in their evaluation on the day before. On the day of surgery, you can have bath and you can come for the OT. Surgeries will be usually performed in the morning time. Usually we will give you anesthesia and then you'll go into sleep. Then I will operate the throat, open up the airway, and post that you will feel much more better. They will extubate you, you'll go into recovery, and the whole process will take about 3 to 4 hours. If we are doing the nose surgery as well, there will be splints placed inside the nose which will be removed after 7 days. The throat surgery, because we'll be suturing the palate anteriorly, there will be some amount of discomfort in the throat till you get used to the changed anatomy. You will have difficulty in swallowing or painful swallowing for about 2 weeks because of the sutures which are placed inside the throat. Overall, there is chance of you having some amount of blood from your mouth secondary to the surgery, and some amount of nose discharge with blood can be noted in case we are operating the nose. Overall, the pain is not too severe but can be managed, and the day after the surgery will teach you the nose wash in case we have operated the nose, or we'll just give you a soft ice cream diet for about 2 to 3 days, because ice cream is good for nutrition wise and also it will help soothe the throat wound. Overall, you will be comfortable. So after the surgery, the next day we will be planning for discharge. If there is less pain, we would have put you on patch which will reduce your pain. It's usually an opiate which will have a long duration of action, so that will reduce your throat pain. For the pain, we will also give you a spray into your throat which you can put in case there is severe pain. We will give you a syrup which will reduce the pain, so you can take the syrup 2 minutes before you have any food. We will follow up 1 week later from the date of surgery. In case if you have operated the nose, the splints from the nose will be removed, and in about 2 weeks from the splint removal or from the first follow-up, we'll again call you back. Then we will do an endoscopy of the nose in case we have operated the nose, and endoscopy of the throat to evaluate how the healing process has occurred. By then you would have already noticed that you would have lost significant amount of weight. Secondly, to better sleep, your productivity would have improved, and your snoring would have almost drastically reduced. Over the period of time, you will notice that your productivity is improving drastically, and also if you go to the gym, you can do the weights more at ease, and you can also run more faster. So overall, if at all you have any diabetes or hypertension, you can also see that the dosage which is required to control your hypertension or diabetes will start reducing. So overall, you would have a better outlook of life.